So, one of the biggest mistakes I see after a stroke when you have one arm that's weak is that people don't realize they're doing things to injure their shoulder without meaning to. And unfortunately, once shoulder pain and shoulder subluxation develop, they can really slow down your recovery and create a lot of, unnecessary barriers. Now, I know I've mentioned the issue of shoulder subluxation kind of here and there in some of my other videos. I believe, like in my video about shoulder pain, and I did one about arm slings. And really, anytime I talk about stretching the arm, strengthening, or positioning your affected or weaker arm, right? So today, I want to do a video all about just about shoulder subluxation, explain what shoulder subluxation actually is, why it happens after a stroke, and how to prevent it. And some really simple things you can start doing today to better protect your shoulder after your stroke. Okay. So let's first talk about what a healthy shoulder is actually supposed to do. Before a stroke happens, all the muscles that come together to create the shoulder joint provide stability and allow our shoulder, which is one of the most mobile joints in our body, to reach overhead, out to the side, behind us, across our body, rotate, lift, push, pull, you name it, our shoulder can do it. But when a stroke weakens the muscles of the shoulder is no longer stable. Those muscles that would normally hold everything together are now weakened or not working at all. And what can happen over time, if you're not really good about keeping that arm and shoulder supported, is that gravity and the weight of your arm can start to pull down on the shoulder joint, creating a situation where that upper arm bone, the humerus, starts to separate from the joint. And and that space, that separation that occurs, is what we call a shoulder subluxation or a sublux shoulder. Now, it's typically best to have an occupational therapist or a PT or another qualified specialist confirm for sure whether or not you have a shoulder subluxation, but you can kind of test it out for yourself by taking, one or two fingers and gently feeling along the outside edge of your shoulder, because typically with a shoulder subluxation, you can actually feel a space or a little dip forming where that upper arm bone meets the shoulder. And then if you apply some support under your elbow and gently lift up, you'll feel that space disappear and close up. And then when you let the support go, you'll see that space or feel that space reappear. Usually in the clinical world, we measure or describe the severity of a shoulder subluxation by one or two fingers, meaning um, the width of the space of that gap, right? So it's not that your shoulder comes completely out of joint. It's more like a partial separation. And again, created by the weakness of those shoulder muscles that would normally, when healthy, be able to hold that joint together and provide that stability. But the big thing to keep in mind here is that the larger the separation becomes, the more stress gets placed on the muscles, the ligaments, the tendons, that joint capsule, and the nerves surrounding the shoulder. And that's one reason why shoulder pain can become such a big problem. Now, not everyone with a weak arm is going to develop a shoulder subluxation, and not everyone with shoulder pain necessarily has a shoulder subluxation. Okay, there are many possible causes of shoulder pain after stroke, and a shoulder subluxation is just one potential piece of that puzzle. So, what can you do to reduce your risk of having this happen to you at all? Number one is positioning. Support your weaker arm always, no matter if you're sitting, laying down, in the shower, sitting on the toilet, quickly moving from one spot to another, standing, walking, anytime, no matter what. Keep your arm supported. And the key here is that making sure that you always have sufficient support under your elbow, because if your elbow is supported, the shoulder is supported, okay? I know I say this a lot, but it is just that important. So if you don't have enough strength in your shoulder to raise your arm to at least what we call 90 degrees, which is straight out like Superman, then all of this applies to you. And you need to be intentional and consistent about supporting and positioning that weaker arm. So, regardless of if you're sitting, again, standing, laying down, your shoulder needs to be supported. So please use soft supports like pillows. You could do folded blankets, special cushions, arm troughs, lap trays, slings if you're going to do any kind of standing or walking. Um, but just do that. Number two, protect it. Never let anyone pull on your arm, please. A lot of times people are trying to be helpful to assist you, but do not let them tug or pull on your arm ever, okay? And again, if you're going to be doing any kind of standing or walking, make sure someone is either with, like, right there next to you, spotting and supporting your arm for you, or you have a really good sling that you're just using for when you're doing standing and walking activities, okay? Number three is strengthening. So, again, intentional, focused strengthening of all those shoulder muscles. So, whether you have no movement yet or are having, and you're having to start with things like visualization and mirror therapy and weight bearing, or if you do have some movement and you're able to safely do some active assisted exercises, with somebody helping you, or you can do table slides or active reaching. All of these things have the potential to help you activate and strengthen the muscles you need to improve, again, that stability in your shoulder. Now, my all-time favorite is weight bearing because weight bearing through that arm can really provide that sensory input and help activate those shoulder stabilizing muscles. I've done several weight bearing videos, so check some of those out. Leave me a comment if you have any questions about that, okay? Just make note, if you already know you have a shoulder subluxation, you're going to want to avoid certain movements like stretching or moving your arm out to the side. This is called shoulder abduction, or any kind of excessive external rotation, right? When your arm is all the way out and rotating all the way back, right? So please just remember, our limbs, our arms are heavy. They're actually a lot heavier than I think most of us realize. They say the average weight of an arm on someone who's about 130 pounds is about 7.5 pounds, and 10 pounds if you're 160, and up to 13 pounds if you're over 200. So just think about that for a second. That's a lot of weight pulling down on your arm, okay? So just don't allow your arm to hang, whether you're sitting or standing, because gravity is going to be pulling downward on your arm, in addition to the weight of your arm, which is a bad combination. So please be fiercely protective of your shoulder, and just give it the support that it needs. Leave me a comment if you have any questions at all about anything I mentioned today, and definitely let me know if you had to deal with anything like a shoulder subluxation during your recovery. All right. As always, guys, I really hope this was helpful, and I will see you next time. If you found this video helpful, don't forget to subscribe for more DIY videos to help you along the way in your stroke recovery. Struggling at home? Have a question? Leave me a comment. I'm here to help.